such as the Dynagrip, and you want to squeeze it with each finger, keeping the finger straight, flexing from this joint here, the MCP, or metacarpophalangeal joint. Finger. Do 3 sets on each finger. Special notice to the 4th and 3rd lumbrical muscles. These are the 2 most commonly injured in climbers.
Pinch something really lightweight like this cup, especially if you had surgery or stuff like this and you have very weak lumbricals. And you can gradually improve this by going into heavier weights like this yoga block, and if that's too low weight for you, you can even pinch your thick books, for example, like this one, and you can go further and further with your weights. You can pinch a chair, and if you don't have any weights to increase the fingertip push-ups like this, or by just doing fingertip holds and hold for as long as you can, and this will give you strong lumbricals if you're into calisthenics or the likes.
A sheet of paper, and you can try to pull it to test their palmar interossei strength. Now the last thing I want to teach you guys, so you can get the patient to actually apply abduction while we apply pressure or resistance against their abduction. So this is
Side first. Have your cups stacked next to the working hand and place the rubber band around the outside of your fingers and thumb. Then have your hand pronated or facing down and use all your fingers to push against the rubber band and slowly pick up 1 cup from the stack and place it on the table. Repeat this process until you have carefully stacked all the cups into a pyramid shape. 3 cups at the bottom, 2 cups in the middle, and 1 cup at the top. Then rest for a few seconds before carefully breaking down the pyramid of cups by taking 1 cup at a time until you have restacked all the cups back to their original starting point. That's 1 set. Building and breaking down the pyramid is 1 set. Rest your right hand by repeating the same steps with your left hand. You will find out that one side will laugh and place it around your index and middle finger. Have your hand well rested on a flat surface with your palm facing down and your fingers extended. Then slowly push against the rubber band, then go back and repeat 5 times. After you're done, relax for a few seconds before placing the folded rubber band around your index and ring finger and push against the rubber band 5 times. Then rest for a few seconds and place the full rubber band around your index and pinky and push against the band 5 more times. That's 1 set. Around your pinky and ring finger. Push against the band 5 times, then relax and place the folded rubber band around your pinky and middle finger. And repeat the same amount of repetitions. Then relax and place the full rubber band around your pinky and index and perform the same amount of reps. Then rest your right hand and repeat the same steps with your left hand.
The last 3 fingers depending on the strength of the rubber band. And what you do right now is you bring your index finger in and back. In and back. 1 1000, 2 1000, 1 1000, 2.
And place an elastic band around your fingers. Try to move your little finger away from your other fingers to create tension in the band. Return to the starter position. Use your other hand to resist against your little finger as you try to move your little finger outwards or away from your other fingers. Your little hand with your other hand. Move your thumb away from your fingers to abduct the thumb. The band will provide resistance to strengthen the abductor pollicis longus.
Away from the palm, and once that starts to get easy, you can progress to using a rubber band, and you can attach it just above the top of the thumb there and abduct away, hold for 5 seconds, and then slowly return back toward the palm. And then you can also attach it around all of the fingers and open the entire hand, holding for 5 seconds, and then slowly bringing the thumb back toward the hand. You can start with 2 sets of 8 and work your way up over the several weeks to 3 sets
Of the band with the opposite hand or thumb. In a neutral hand position, with your fingers curl and your thumb slightly up, you're going to slowly push against the band by separating and extending your thumb. Then slowly let your thumb go back down and repeat 15 to 20 times.
Rotate your thumb towards the little finger while you push the putty, and this will strengthen the opponents. Another way to strengthen the opponents is to pinch the putty with a rounded thumb and pull. You should feel this muscle working in your thumb.
Setting your shoulder blade and then rotating the arm out this way and back in again. Excellent. And looking to repeat this slowly as you do so. It's a nice controlled move. It might hold it for upwards of 3 seconds in one location and then switching again. Controlling it all the way through.
Ulnar deviation. Once you get them there, they can then just twist this puppy down like this and slowly let themselves back to neutral. That's it. And then if they go back, they're doing both concentric and eccentric. Now, we did talk a little bit about the benefits of eccentric strengthening when we did that reverse Tyler twist, that some studies show that eccentric strengthening might be better. So what she could do is start here, right? Crank down, go back to neutral. And then when you start over, get into position, crank down, slowly go back to neutral.
Got it.
All right, let's try that a couple times. So start over,
Crank down,
and then a nice 4-second eccentric. 2, 3, 4, back to neutral.
Platform. I don't want that elbow moving at all, so it's nice to utilize your other hand with that. When you're doing this, I want a nice neutral wrist, so my wrist is staying in the same position, all right? And we want it to pronate and then back to supination. Going nice and slow both ways. You're not trying to go all wild and crazy moving this around. I don't want you kind of moving it around any other way. Literally just going back and forth from pronation to supination.
Supination as he goes throughout the entire range of motion. By doing this manually, I can really make sure that I'm giving resistance in the areas where he's a little weak. I'm making sure it's
and nice and easy. Start off light at first, and if it's too light, then go up another pound. If that's too light, then go up another pound until you find a weight that you can feel that you can do a good amount of reps for, but you need to take a break after like 10 or 12.
Through supination until the hand is facing the ceiling. Patient will hold this position for a minimum of 30 seconds and then slowly guide the hand back to the starting pronated position. Repeat for a total of 3 sets. Pass the uninvolved hand, bring the involved forearm into supination. Once the forearm is in supination, allow the weight of the hand weight to stretch the muscles. After 30 to 60 seconds, the patient will remove the hand weight and bring the forearm back to the starting pronated position. Repeat for a total.
Go into your fingertips, finger wrist curl.
My dumbbells are smaller.
Remember, literally on the end of the dumbbell and rotate it up. Remember guys, take a rest when you need it, then get back at it. I wish we grabbed some lighter weights. There you go. The cameraman's laughing at our pain rate. Let's go. Come on, keep pushing it. This isn't easy. Last exercise of the circuit. Come on.
As I pan around him here, you can see he's using a hammer grip on the dumbbell. He's leaning his torso forward. Hammer curl. Using the cable machine. As you can see, we have an incline bench set a little bit greater than 45 degrees. This allows you to get a better range of motion. We have a rope attached to the top pulley. He's grabbing at the very end of the ropes and again using a hammer grip, because when you use a hammer grip, the biceps go a little arms. So you get a lot of thickness in the forearms and then up through the brachioradialis and the brachialis. He's back at about 45 degrees. He's got about a shoulder width grip on the bar. As you can see, very, very important.
Position his body up, elbow tucked to the side, and curling straight up. So the really cool thing about this movement, what separates it apart, is as you curl up, the mechanics of this lever here.
Then we can also extend our fingers straight. So these are really good for climbers.
Start with your pointer finger with a band on the end of your pointer finger. Barely lift up and then relax it back down. And then you'll repeat with the middle finger and ring finger. Take the band around the ends of the fingers, barely lift up and relax it back down. Try to keep the other fingers from moving. So try to just isolate it in those two fingers. And then lastly, you'll repeat with the pinky finger. Take the band around the pinky finger, barely lift it up off the surface, and then relax back down.
Take it out, so it's already adding pressure on my supinator muscle, like this. And from here, I will hold it for a few seconds, and then slowly, slowly, slowly release. Going back, supinated, isometric work, and eccentric work. So,
I'm then going to have you smash the flex rod into your forearm. So that automatically turns you down into ulnar deviation, which means now all of your radial deviation is now resisted. Right? So we're actually resisting radial deviation, not just from neutral, because if you try to resist radial deviation just from neutral, right? Like if you let this go. If you were to just go from neutral and then radial deviate, can set it up on their own, and having them do the other hand sometimes is an easy way to do that. What aren't you doing on this hand that you need to watch out for? Okay, good smash. Yeah, make sure your wrist is in flexion. There you go. That's actually a pretty easy thing to teach, guys. Make sure
you want to put your thumb on top, and you want the windows of your elbows pointed up. And what we want to do is, you can see really good. I can turn this over without having to use my body. So, right there, okay? This is my weaker one that I use.
So right here, what we're going to do, I put it in a position of supination, which is opening the hand, and I chose an arbitrary range. You can choose here if you want to, you can choose here if you want to, but notice that I'm not moving the weight. Okay, I'm just holding it, and then I can do a break. And I can hold it again. And you can hold it for as long as you want to based upon what your healthcare provider recommends, but I would suggest eventually doing it in different ranges of motion. Eventually you can get to a concentric and eccentric motion. This comes a little bit later just because they're a little bit more dangerous in regards to damaging the area if you do it too soon. But notice that my elbow is bent because if you go like this, you start spinning at the shoulder. So again, this is the isometric contraction exercise for the pronator.
First exercise is radial deviation. What you do is you just grab the end of the broomstick and let the other end go into the floor. Lift it up nice and slow. And this works on the muscle over here. And your wrist flexors and your wrist extensors. But hard for you, just move along to the center of the broomstick, and this end will act like a counterbalance, and it'll be less weight on the broomstick itself. So just go up and slowly. so. And with this exercise, just do 10 reps, 3 sets. It works on your wrist flexors and your wrist extensions as well. Also helps a little bit of your grip strength. And if that's too hard for you, once again, just move towards the center. Let this be a counterbalance, and this will be less weight on the end of it as well. So go up and down. The next exercise is a supination exercise. This is for forearm strength, wrist strength, and grip strength as well. Face your palm down, grab the end of the broomstick, and then rotate up, like so. Nice and slow, and down again. We'll do 10 reps of this and 3 sets of it. Do it nice and slow. Now, once again, if it's too hard for you, move your hand towards the center of the broomstick and then lift up again. This exercise will also work on the bicep muscle. For the other exercises, grab it like so and then go up, nice and slow, and up. Nice and slow. Once again, if it's too hard for you, make sure you move towards the center of the broomstick so there's a counterbalance and it'll be less weight on the end, and pull up. Obviously you can use a dumbbell wrist flexion, everyone does this. However, it doesn't work on your grip strength. So what you do is you can do this separately, which basically is 10 reps, 3 sets of this, and it works your forearms. Remember, don't actually pull all the way up. That would be a bicep curl. Now for the pull the dumbbell down a little bit like so, and then flex your fingers up and up, all the way up like so. Now for the extensors, grab it and lift up. I don't recommend you doing any of these exercises for shoulder injuries or...
You can stretch the lumbricals individually, each finger by just pressing the finger up and holding. And repeat with the next finger if you have individual fingers that need stretching, like so. Or you can extend your arm like this and so just grab the lower part of your fingers, have your elbows straight and just pull backwards. And you can hold this up to 30 seconds or...
Take the hand, press it straight in. You're going to push the fingers back. You're going to feel it stretch kind of in a weird spot. You maybe can't identify it, but it's somewhere in here. And you can take the next 2 fingers, do the same thing.
Finger 5 times. To progress, increase repetitions.
Squeeze your left hand such that the right little finger and thumb come closer together. Hold for about 30 seconds and release. Remember to stretch the other side as well.
And then you can move down and up, so you apply pressure here while moving your thumb. In structural massage, we call this static pressure with active motion, and it's one of the most effective ways to release a muscle. And look how high the muscle moves all the way up here. I can still feel it moving all the way up here. So that's the flexor pollicis longus, and spend 3 or 4 minutes.
Involved hand perpendicular to the patient's body on the surface of a table. The patient will walk backwards around the table, leaving the hand on the table surface until a stretch is felt on the anterior forearm. Hold this position between 30 and 60 seconds and return back to the starting position. Repeat for a total of 3 seconds.
Keep the elbow straight, bend the wrist down so you can use your hand as a bit of leverage to help push into a little bit more pronation to stretch that supinator. That's it. It's that simple. So just
bending the arm out, bending at the wrist, taking the other hand by the knuckles, and giving it a little bit of overpressure. Make sure you're not hurting yourself or your wrist, and you're just bending it to the point where you feel a slight stretch. You could go deeper if you wish, but make it if needed. Make sure you're not shrugging the shoulder, and keep your shoulders relaxed so you're not straining your neck. That stretch involves you overlapping your hands together, clasping, and then pulling the fingers towards you, so there's a little bit more of a rotational stretch in the forearm extensors. Watch out for shoulder shrugging. You don't want to strain your neck, so keep your shoulder relaxed.
So here's the best stretch, to stretch the brachioradialis. If you've worked really hard, you extend your arm like this, have your palm facing down, and then you flex your wrist like this, and then you turn and rotate it outwards like this. And this will give you a really good stretch in the brachioradialis up here. So once again, hands down, flex in the wrist, rotate outwards, and hold.
Together. So now we're in this position. Okay, now, right off the bat, what I want to do is I want to straighten my elbows. Right? We talked about that. Those other muscles like to kind of bend our elbows and flex them. So we want to straighten them out to get that stretch started. The next thing we want to do is, if they want to turn our arms up, we want to turn them down. So again, I'm stretching the one on top here. I use my right hand, this arm over here, to turn it down. Turn down that way. And then lastly, I use that same hand to pull my wrist into flexion. It's right here when we start, nice and straight like that. And I use my right hand, which is the one underneath here where my thumb is, and I pull down into flexion. So I've got straight arms, I'm pulling into flexion, and then I'm twisting down into that pronation.
A little lump underneath the bicep down near the elbow. It had been a problem for quite some time. I have placed him in the standard bicep stretch position, but with the addition of a yoga block underneath the back of his wrist, like so. In the push-up position, like this. He brings on the bicep stretch by rolling himself backwards. I reposition his head on the floor for maximum comfort, and then gently...
So the back of the hand you're stretching is on the outside of that same knee. Take the other hand over the top and keep the stretching side straight, so keep the left elbow straight, and I just ease back on the wrist. And as I'm easing back there, what I can feel is a strong stretch on the left.
Just don't apply as much pressure because it's a bony area, but the muscle does go all the way down to the styloid process, so we don't want to get some of the tissue in here. So I'm going to use the, starting in this position, real light. Like I said, it's more of a bony area, but I'm going to just roll in different directions, back and forth, side to side, like diagonal, and I'm going to spend about 30 to 60 seconds, and I'm going to move up in 1 inch increments, and every time I move up to a new spot, I'm going to spend 30 or 60 seconds just relaxed position. I'm going to take the Tai Chi ball, I'm going to put firm pressure down, and then I'm going to pull towards my elbow to trap the tissue, and at that point I'm going to extend out in this direction. And I'm going to do that 5 times on that one spot, at which point I'm going to come down 1 inch again, elbows bent, I'm pressing firm pressure in, pulling towards the elbow, and I'm going to stretch out the muscle 5 times as I hold firm to perform that. So what we're basically doing is we're trapping that, stretch out the muscle 5 at the origin of the brachioradialis. One last time, firm pressure, pulling up now towards the shoulder, and then I'm going to make an extension.
Around, and I'm going to grab the interphalangeal joint here, just proximal to that. I'm going to pull up, don't pull up. That is testing the brevis. Okay, the longest, I'm going to do the interphalangeal joint. Go ahead and flex this joint here. Don't let me pull up. That is testing the longest. Manual muscle testing of the flexor.
So third one is this one. This one is put your 2 fingers here at this joint, right? Then pull back, okay, and just stretch back like this. Okay. This one. And bend your elbow. Bend your elbow. Bend your elbow and just let it drop and relax. Okay. This one, I think you're
below the distal knuckle. Actively bend the finger at the distal interphalangeal joint. Patient should perform 3 sets of 10 reps. To progress, increase reps and/or sets.
Your arm. this is the best way to do it. Every time I find a spot where I feel something, I just do this. Put the bone in between. So right here, the ulnar bone goes between, and you work on the other sides where it's usually hard to get there. So this is as good as working with a ball, but it's better than nothing, you know. So you can work with this and spots, you can work it out with this one. So it works just as well. All movements, little circular movements to one side, to the other side. So some guys I have seen working with the handles, and I would not recommend this. Get a handle and get a piece of towel, wrap the towel around the handle, putting your arm.
2 sessions per day. Gradually progress to 15 to 20 times, 4 sessions per day. Downward rotation of the hand with the opposite hand. Hold for 10 seconds.
In supinated position, and then pronated all the way up. I don't like to go full supination. I like to stay like this. So you're working from 45 degrees. Use judo. Putting it over your wrist and over your palm like this. So here you will actually do bigger weights, because there's less stress on your grip.
My wrist, I'm going to start at my sternum, and I'm going to push my wrist down toward my belly button. And what that does, that increases the flexion of my hand. Now, elbow toward the camera. Now, I want you to hold the stretch for 30 seconds, and while you're holding the stretch, I want you to breathe with a certain cadence. Sits at the base of the wrist. It's square. The second reason is that put your other thumb on the back of the palm. So what I'm going to be doing of the palm, and now I want to push the elbow forward. So I'm pushing my elbow toward the camera.
As I don't necessarily want to extend the fingers, it's good if I do the movement from around here. Yeah? And then you can play by rotation like that to see how the stretch is more effective. You see now I'm not completely vertical with my hand, I'm tilting it inwards, i.e. in the opposite direction of how the muscle works.
And start digging around. Slowly take your time, leaning some pressure on there. Move it around nice and slow so you don't flip and flop back over the muscle too much. At first, I kind of use the edge of my ulnar bone as a guide because the muscle kind of goes along the side of it. And then as the muscle starts to soften up and I can kind of get in there a little bit and it's not popping around as much, then I'll start to go more directly onto the flexor carpi ulnaris muscle and dig around. And I kind of like to rock around and
then take the opposite hand, and you could place it on top of the forearm or underneath and slightly increase the stretch with assistance from the opposite side. So this is moving in to stretch, then use the opposite hand for assistance. You could reach underneath or you could reach on top, whichever way that they want to do it, and increase the amount of supination to improve the stretch on the pronator teres. Hold a mild, comfortable stretch.
First technique, it's basically you find the muscle, it's here, put your finger on it, grab your elbow from the other side, put some tension on it, relax your arm, supinate and extend and back. Do this like 5 times, or put the pressure on it, pronate the arm, do the same thing you did there. So we're extending, put it on a bench and lean into it. And again, So, so I was touching the insertion point and I didn't feel anything there, so I'm going a little bit up. So I'm going up, squeezing, supination, extension, and leaning into it. Slowly, 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 releasing. You're going against the wound. With the other arm, you're helping, yeah? And again, slowly, slowly, slowly releasing. Again, maybe
You can really feel that in there?
Yeah, it's
really
also
getting
good
in
for
there.
computer work too, I think. It's
Oh,
good for doing at work.
Absolutely, absolutely. Okay, and you can also just take one ball and kind of work it up and down with the thenar ends there too. So you can move it around, but you really want to get some motion in there. So don't just kind of go real light, but work it around until you feel a tight spot. Then get right in there and work an angular surface there. Give that a try, Mickey. Just kind of up, right across. So right up, so if we're going across here, we'd look here and we'd have that triangle just like this, so kind of back and forth right across. Yeah, just kind of right up into that area. Okay. Right across. Good, good. Do you feel that?
Yeah, that's nice.
So a lot of times down, right across the entire area. Now, the thing is, when you're trying to get into these structures, you're going to be covering multiple structures, not just one. And there will be fascial connections between different layers of tissue. So it's not as if we're just going to work on one structure, we're going to work on multiple structures in the area. And as you get in, you may find that maybe there's
a pretty good chunk of muscle in there.
yeah, a little tender on that side there?
Yeah.
Okay, good. But get in there, work 15, 20 seconds, something down, and really get in there, okay? Work it back and forth. So you might want to do it in striations where you go outside a little bit there, inside, back and forth, take it up and down.
Hi everyone, Ian Harvey here, massage therapist.
Hit checker. Okay, hold it. Don't let me bend it. Okay, then I'm moving back to CMC, starting in flexion, extend, hold it. Don't let me bend it. Okay.
This way. Tendon at the styloid process.
Let go, tighten up, let go, tighten up. With each tightening up, with each contraction of your forearm, you can feel the muscles here in this area contracting. And in this area there are also the most important points of the brachioradialis, which basically as you want. I just wanted to show you what I am doing here, because maybe it's also beneficial for you. At the moment I'm a little bit too high, so I will go a little bit lower with my whole body. Now it's way better to massage myself. It feels already way better. And as you can see, I'm rolling over my forearm.
Get subscribed to my shoulder, and then I put my left elbow on the affected area, like this. So the tip of my elbow is useful, for, it acts like a tool. And that moves the elbow, the tip of the elbow. Okay, Medax, not right now. And you can also coax it back and forth like this.
And your hand, and we're going to stretch it out. Now, you want to make sure that you actually maintain your compression on this. Now, what I want you to do is actually go to the edge of the table here and push down a little bit while maintaining that compression.
Yeah.
Okay, so you feel that on there?
Yeah.
Okay. So you're keeping your traction up in this direction too on your
Yes.
thumb, aren't you?
Yes.
You're pushing in and going up.
Yeah.
Good. And we'd hold that just for a short time. Okay, then you release. Good. Now move your thumb just a little bit farther, even more, just for example there. Okay, and again, take some pressure up here, push in. Good. And then take this down from here. So this is a pin and stretch technique. An exercise that you can do yourself at home. Because you have a lot of very sensitive structures here. You have certain nerves near the surface. We have vascular structures, veins, arteries. So we're going to take it all the way up and down and kind of moving in little incremental points here like this. But we'll start moving around in a circular fashion. And we find a point that's a little bit tender. We're going to put a little bit more pressure on that, not much, and keep it in that area until we feel a nice release. So we want to kind of take it in here. We've got a little muscle that comes off the side here called the supinator and aconius. And we can actually start to move it back and forth in that area here. But I find the circular motions actually work really well to get to release. Now, you probably want to spend maybe a minute or two actually doing this. And if you find certain areas that are really
with the wrist in a